Hello and welcome to Chapter 1, Lesson 1 of your phlebotomy course at Queensborough Community College. Chapter 1 is going to be titled Healthcare Settings and the Role of the Phlebotomy Technician. So there are many different ways to refer to healthcare workers whose primary duty is to collect blood specimens. This book uses the term phlebotomy technician, phlebotomist interchangeably. Also refers to phlebotomists with the abbreviations PBT. So before we do anything, let's discuss the healthcare system and describe changes in staffing trends. Healthcare is a growing field. The healthcare system refers to the different kinds of providers, facilities, and payers involved in delivering medical care. Providers are people or organizations that provide healthcare, including doctors, nurses, clinics, and agencies. Facilities are places where care is delivered or administered, including hospitals, doctors' offices, clinical laboratories, and treatment centers. Payers are people or organizations paying for the healthcare services. These include insurance companies, government programs such as Medicare and Medicaid, and individual patients or clients. Together, these people, places, and organizations make up the healthcare system. Many facilities hire workers with specialized skills and build teams to care for patients, with each team member meeting a specific patient need. In the past, doctors examined patients, diagnosed illness, and planned treatment. While nurses did more of the other patient care tasks, today many healthcare workers share those other duties. Specially trained technicians perform medical tests such as electrocardiograms or sonograms. Medical assistants record patients' medical histories or measure their vital signs, just among other tasks. Phlebotomy technicians are part of this trend towards hiring specialized healthcare workers. The Department of Labor forecasts about a 23% growth in the hiring of phlebotomy technicians over the next several years. Average growth for other job categories is about 7%, so this is an extremely fast-growing field. Healthcare workers of all kinds will likely continue to be in high demand. People will always need to receive health care, and populations in particular needed care, such as the elderly and disabled, are constantly growing. So healthcare is provided either in an inpatient or outpatient settings. Inpatient care is provided to patients who must stay at the healthcare facility overnight. Hospitals generally provide inpatient care and usually care for people whose illnesses are acute, meaning the illness is short-term and must be treated immediately. Urgent care centers, public health clinics, doctors' offices, and freestanding emergency departments, in other words, not physically connected to hospitals, are all examples of outpatient healthcare facilities. Outpatient care, which is sometimes referred to as ambulatory care, does not require the patient to stay overnight. Outpatient care has become more common for surgery and other procedures that once required a hospital stay. Hospitals may be public, meaning they are funded by taxes, or private. Private hospitals may be for-profit, in other words, a money-making business, or non-profit. Costs are covered, but profit is not generally distributed among stockholders. What both public and private hospitals have in common is that they operate 24 hours a day and care for sick and injured patients. They are organized into different departments to care for patients with different needs. Hospitals also have emergency departments where care is provided to patients who need immediate care for any injury or illness. Patients are either discharged and released from the medical facility, or they are admitted, checked in to receive inpatient care. Urgent care centers and freestanding emergency departments are outpatient health facilities where patients can be treated without an appointment. Urgent care centers usually have longer hours than a typical doctor's office, but are not open 24 hours a day. Freestanding emergency departments, which may be associated with a hospital or may be independent, are usually open 24 hours a day, 7 days a week. Most freestanding ERs are staffed at all times by an emergency physician, and most have more services and equipment than a typical urgent care center. As more freestanding emergency departments open around the country, many states are establishing rules about the services, medicine, and equipment that must be available at these facilities. Doctors may run their own private practices with or without partners, or they may have offices associated with a hospital or healthcare organization. These facilities can range from an office staffed by a small number of employees to a multi-doctor clinic with a large staff and a full range of medical services, including laboratory services. Smaller offices usually send patients to an outpatient laboratory for any necessary tests. Public health clinics are outpatient healthcare facilities where patients with low and moderate incomes can receive medical treatment at a reduced cost. Each clinic is different, but these facilities generally receive support from federal, state, and local government and provide basic services like vaccinations, well checks for school-aged children, women's health services, and family planning. They may be operated by city or county health departments. Long-term care facilities are businesses that provide skilled care 24 hours a day to residents who live in the facilities. These facilities may offer assisted living housing, dementia care, or subacute care, which is inpatient care for patients who require more care than can be provided at home but do not necessarily need the services of a dedicated hospital. Some facilities offer specialized care while others care for all types of residents. The typical long-term care facility offers personal care for all residents and focused care for residents with special needs. Phlebotomy technicians and other types of healthcare workers often visit long-term care facilities so the residents do not have to leave to receive care. Clinical laboratories, which may also be called medical laboratories or diagnostic laboratories, are key to both inpatient and outpatient healthcare. These laboratories collect and analyze specimens from patients in order to provide doctors and other healthcare professionals with information. This information may be used for routine screening, as in an annual wellness exam. It may also be used to help diagnose an illness or to gather more information about a problem a patient is experiencing. Laboratories can be located inside a hospital or other healthcare facilities, or they can be separate facilities. Some doctors' offices have limited laboratory facilities and refer patients to larger labs for certain tests. Each clinical laboratory is different, but they have some things in common. All laboratories collect and analyze specimens or samples from patients. Common specimens include blood, urine, stool, and sputum, or mucus coughed up from the lungs. They can also include body cells, such as swab collecting cells from the inside of a cheek or tissues, as in biopsy, that removes the tissue to examine it for signs of disease. Not all specimens are analyzed at the same laboratory where they're collected. Reference laboratories do not collect specimens, but analyze specimens collected in another place. These laboratories may be far away from the laboratory or doctor's office where the specimens were collected. Laboratories in the United States must meet standards listed in a set of regulations called the Clinical Laboratory Improvement Amendments Act. That is a term you'll need to be quite familiar with. These include educational requirements for certain laboratory employees, as well as rules for handling patient specimens, and test and quality assurance and control practices. The goal of CLIA is to make sure patients receive the best quality care and that their laboratory tests are performed safely and accurately by qualified personnel. And more information on that will be in the next chapter. Although they're not legally required to do so, laboratories may also be accredited or officially approved by different independent organizations. The Joint Commission, which was formerly called the Joint Commission on Accreditation of Healthcare Organizations, or JACO, which was very difficult to pronounce, and the College of American Pathologists are some of the more common accrediting agencies. Scientists and technologists are likely specialized in the following areas, which are departments within the laboratory. So there is the chemistry department, which works to analyze blood and other specimens for the presence of particular chemicals. Cholesterol, glucose, and hormone levels are examples of analysis done in the chemistry department. Hematology involves blood diseases, and coagulation, or the process of blood clotting. They're all studied in this department. The number and types of blood cells and specimens and details about the composition of the blood, such as its capacity to carry oxygen, are part of the hematology department. Microbiology In this area, the laboratory scientists study microorganisms, or living things so small they can only be seen under a microscope. Bacteria and viruses are types of microorganisms, and they can sometimes cause disease. Blood and other specimens can be cultured, which means that any microorganisms presented are caused to multiply. In this way, the microbiologist can analyze the microorganisms in the patient's specimens. This helps the doctor diagnose illness and plan the best treatment. In this case of a bacterial infection, culturing the blood can help the doctor understand which antibiotics might be the most successful in fighting this type of bacterial illness. Immunology is a department where blood and other body fluids are tested for different factors, such as antibodies, that affect the body's response to disease. Antibodies are part of the body's response to foreign materials like viruses and bacteria, and these tests can help in monitoring a patient's response to cancer treatment, or can help manage the body's response to an organ transplant. Allergy testing, for example, is also part of the immunology department of a lab. The blood bank, or immunohematology. These operations focus on collecting and preparing blood for transfusion. Blood typing and analysis for donor-recipient compatibility are performed in this department, and is a major important department as well. Blood and blood products are prepared for transfusion. Pathology is the study of the cause and effects of disease. This department studies body tissues and other specimens to determine the presence or progress of disease, whereas the cytology department specializes in the examination of the structure and function of cells. In a clinical laboratory, cells are studied for signs of disease, most commonly probably cancer-type cells. The urinalysis department performs various tests on urine, including visual inspection, microscopic inspection, chemical testing as well. Urine may be tested to diagnose illnesses or as a part of a management of various illnesses or conditions. And so you're going to hear the term STAT test quite often. A STAT test is one that must be performed immediately, and laboratories may have a department specifically designed to handle these tests. The STAT department may perform tests normally done in other departments when results are needed urgently. So just to recap, let's remember these key points about clinical laboratories. They collect and analyze specimens, including blood, urine, stool, sputum cells, and tissues. Depending on the facility itself, analysis may be done on-site or sent to a reference laboratory. The Clinical Laboratory Improvement Amendment, the CLIA, established requirements for the laboratories operating in the United States. Independent organizations like the Joint Commission, although not required, can also accredit laboratories. And laboratories have different departments for the analysis of different types of specimens, such as chemistry, hematology, immunology, and blood bank, as well as others. So phlebotomy technicians, as well as EKG technicians and certain patient care technicians, are examples of team members who are trained to perform a specific task. They do their jobs like blood drawing and conducting tests, and they must have usually a high school diploma as well as additional education, training, and processes to determine how well or how their level of competence in doing their ability. And that usually requires them to take a certification exam. Certification is basically an acknowledgement that a particular individual has met all the educational requirements to do that particular field. It says nothing about really their competence or their ability to perform the task. Licensure, on the other hand, is a legally required process that must be completed to practice a medical profession in a state. In most states, phlebotomy technicians are not licensed. They're not necessarily even required to be certified. However, certification does go a long way in making you more eligible for employment. Uh, Healthcare workers, like phlebotomists, carry out instructions given to them by their supervisors. The supervisors usually act on the instructions of the physician, laboratory director, or other member of the healthcare team. This is called the chain of command. It describes the line of authority at a facility and helps make sure that patients get proper health care. The chain of command also protects employees and employers from liability. Liability is a legal term that means someone can be held responsible for harming someone. For example, if a patient had a seizure during a blood draw and is injured, there may be a question of whether the phlebotomist is responsible for the injury. If the blood draw was ordered by the patient's physician, performed according to policy and procedure, and the phlebotomist responded to the patient's seizure appropriately, the phlebotomist is unlikely to be found liable. This is why it is important for team members to follow procedures carefully and for the facility to always have a chain of command. All healthcare workers must understand what they can and cannot do. This is important so they do not harm patients or involve themselves or their employers in a lawsuit. Certified healthcare workers, like phlebotomy technicians, are not licensed healthcare providers. Everything they do in their job is assigned to them by a licensed healthcare professional and must fall within what's called a scope of practice. A scope of practice defines the tasks that a healthcare worker are allowed to perform according to state or federal law or to facility policy. Laws and regulations may vary from state to state, so it is important that healthcare workers follow their facility's policy regarding their scope of practice. So every patient at a healthcare facility has different needs and problems. Healthcare professionals with a wide range of education experience will often care for them. These people are considered the healthcare team, and together they provide all the different types of care a patient might need. Members of the healthcare team include the following. First and foremost, and most important, is the patient. The patient is an important member of the healthcare team and is actually the reason the team exists. Providing quality care means placing the patient's well-being first and giving him or her the right to make decisions about choices of their own healthcare. We talked about certified healthcare workers such as phlebotomists and EKG technicians who provide patient care uh, under the delegation of their supervisors and their physician providers. Licensed practical nurses, or LPNs. A licensed practical nurse or licensed vocational nurse administers medications and gives treatments. An LPN or LVN is a licensed professional who has completed 1 to 2 years of education and has passed the national licensure examination. A registered nurse in a hospital, long-term care facility, or clinic. The registered nurse coordinates, manages, and provides skilled nursing care. This includes administering special treatments and giving medications as prescribed by the physician. In a hospital, a registered nurse also assigns tasks and supervises daily care of patients by nursing assistants or patient care technicians. An RN is a licensed professional who has graduated from a 2 to 4 year nursing program. RNs have diplomas or college degrees and have passed the national licensure examination. They may also have additional academic degrees or education in specialty areas. Hospitals and other healthcare facilities often employ a wide variety of therapists who help meet patients' needs. Speech languagists, pathologists, physical therapists, respiratory therapists, and occupational therapists are just a few examples. All of these team members have different education and clinical experience requirements for their jobs. Most physical therapists have doctoral degrees. Speech-language pathologists must have a master's degree, and respiratory therapists must have at least an associate's or a bachelor's degree. All must meet state licensure requirements. A registered dietitian assesses a patient's nutritional status and creates diets to meet patients' special needs. They may also supervise the preparation of food and educate people about nutrition. A facility's pharmacy department maintains supplies of medication and ensures a patient receives the medications they need. Pharmacists must have doctoral degrees and are licensed to practice pharmacy medicine. Pharmacy technicians who assist with measuring, packaging, and labeling medications generally have a high school certification or education and specialized training or certifications. Nurse practitioners or physician assistants are a growing field of medicine. These members of the healthcare team can perform many duties usually associated with the doctor. In addition to the responsibility common for RNs, nurse practitioners and physician assistants can examine patients, diagnose, and usually can prescribe medications. States have different rules and protocols about the tasks that these practitioners can perform and the level of doctor supervision needed they are required to have. NPs and PAs have master's or doctorate degrees and several years of experience in the healthcare field. They too must also be licensed. And then finally, there's the physician or doctor, either MD or DO. Most people have not heard of a DO. DO is a doctor of osteopathy. But the doctor diagnoses disease or disability and prescribes treatment. Doctors have graduated from a four-year medical school, which they attend after receiving a bachelor's degree. Many doctors also attend specialized training programs after medical school. Doctors must be licensed to practice medicine and may also be certified in one or more specialties. This slide again just reminds you of how important following the chain of command in any healthcare facility is. It provides a clear line of authority, it protects employers and employees from liability, and it helps ensure patients get the proper care. And just again, remember, phlebotomists and other non-licensed healthcare workers work under the authority of their supervisors. So they work in what's called a delegatory role. It's essential to follow the chain of command and respect the scope of practice. Violating the chain of command or working outside of your scope of practice can lead you to be susceptible to a lawsuit and loss in a lawsuit. So, for example, a phlebotomy technician is allowed to draw blood from a patient's vein. They are not allowed to draw blood from a patient's artery. That's something that an advanced practice physician is able to do. If the phlebotomist were to go ahead and do something like that, they would be considered negligent and could be susceptible to a lawsuit. And that's just one of many examples we'll speak of during the course of this class. Most blood specimens that a phlebotomist collects are collected through venipuncture or puncture of a vein with a hollow needle. Veins are the blood vessels that carry blood towards the heart. Some blood specimens are not collected from a vein, but from tiny blood vessels just beneath the skin called capillaries. Capillary punctures or dermal puncture specimens are collected by puncturing the patient's skin, usually on the fingertip for adults and children, or on the heel for infants. Drawing and processing blood specimens is the phlebotomy technician's primary responsibility. Specimens of a patient's blood may be required for routine screening, such as checking cholesterol levels or the number of red and white blood cells. Routine blood tests can also give doctors an idea of how well a patient's organs or body systems are working. If a patient is experiencing symptoms, a blood draw might be necessary to investigate possible illnesses or disorders. Cancer, heart disease, and diabetes are some of the illnesses that cause changes a blood test can detect. Blood tests can also measure the effectiveness of an ongoing medical treatment, such as whether a blood thinner is causing the patient's blood to clot more slowly. Phlebotomy technicians are responsible for making sure the blood specimens used to perform tests are of the highest quality. This involves several key tasks. For one, working professionally with all patients, some of whom might be anxious about needles or blood or fearful about the possibility of their diagnosis. Creating a calming atmosphere. Ensuring accurate patient identification. I'm going to repeat that. ensuring accurate patient identification. That is a concept you will hear over and over and over again. Answering patient questions about the procedures as appropriate, referring questions about results or diagnosis to the patient's doctor, giving a patient their diagnosis or giving them medical advice is outside the scope of practice of the phlebotomist. Closely following the correct collection procedures for each type of test, observing infection prevention precautions and procedures, protecting patients' confidential health information, keeping the patient safe during the collection process, and correctly labeling and transporting specimens. And I will also reiterate how important that is as well. Remember, there is no federal definition of the scope of practice for phlebotomy technicians. There are some state level definitions, but most of all, it's usually done within the scope of the facility that you're working. So always follow the scope of practice, the policies, and the guidelines set forth by your particular facility. The scope of practice for phlebotomy technicians may vary from facility to facility. Usually it's limited to the collection of blood specimens through venipuncture and capillary or dermal puncture. In some cases, phlebotomists may also collect non-blood specimens such as urine, stool, or cells from the cheek or throat. They may perform some very simple tests on blood specimens. Phlebotomists should not discuss why a doctor has ordered a test or what diagnosis might be associated with particular results. For these questions, the patient should be referred to the person who ordered the test. Phlebotomists should not offer opinions about a patient's health and should refer any questions or concerns of this sort to the doctor. In some facilities, technicians are trained in broader skills such as taking a patient's medical history or measuring vital signs. These duties should only be performed if the phlebotomist is trained and authorized to perform them. Tasks that are usually considered to be outside the scope of practice for a phlebotomy technician include just some of the following: providing test results, discussing or interpreting results, offering medical advice of any kind, even the provider's recommendations, performing tests on specimens other than certain simple tests as ordered as allowed by the facility. More on this topic later. As I said before, drawing blood from arteries or performing arterial blood gas results, drawing blood from an indwelling port or an intravenous line, any type of injection, unless you are working as a certified medical assistant, which most of you are part of the bigger broad course, inserting or removing intravenous lines. An instructor or an employer may provide a list of other tasks outside the phlebotomy technician's scope of practice. In some cases, a phlebotomist may have the training to perform a task that her employer considers outside the phlebotomist's scope of practice. The phlebotomist must follow the employer policy on which tasks they can and cannot perform. So moving on, we want to familiarize ourselves with a few more terms, such as policy, procedure, and requisition. A policy is a course of action that should be taken every time a certain situation occurs. For example, a very basic policy is that healthcare information must remain confidential. A procedure is a method or way of doing something. For example, a facility will have a procedure for reporting any incidents that occur with patients, like patient fainting from a blood draw or something to that effect. A requisition is an order for a diagnostic test to complete it. It could be either printed out on paper or ordered on a computerized order entry form. Employers are going to have policies and procedures for every patient care situation. New employees will be told where to find a list of policies and procedures that all staff are expected to follow. These have been developed to give quality care and protect patient safety. Procedures may seem long and complicated, but each step is important. Phlebotomists must become familiar with and always follow policies and procedures. Common policies at hospitals and clinical laboratories include the following. All patient information must remain confidential. This is not only a facility rule, it's also the law. More information about confidentiality, including the Health Insurance Portability and Accountability Act, otherwise known as HIPAA, in Chapter 2. The requisition or testing order form must always be followed. Phlebotomy technicians can only collect specimens assigned through the requisition form. Collection of specimens for tests that are not listed or approved by the practitioner who completed the requisition should not be performed. Healthcare workers should not do tasks that are not included in their job description. In other words, they must stay within their scope of practice. Healthcare workers must transport important events. They must report important events or problems with patients to a supervisor. Don't take it all on yourself. All employees must be on time for work and must be dependable. That goes hand in hand with professionalism. Okay, so a few more terms and definitions to be familiar with, because as we proceed in this course, there will be chapters dedicated specifically to these terms. First off is quality assurance. In healthcare, ensuring that care is being provided according to the facility policy and procedures with results to meet expectations. All healthcare institutions look for quality improvement. In healthcare, these are practices that seek to make better in a way that can be measured. Can we reduce our specimen errors? Can we increase time that it takes to get from patient to patient? Can we reduce the incidence of accidents? Quality control in healthcare involves processes put into place to document that standards are being met according to certain guidelines. And these guidelines are usually implemented by the Clinical Laboratory Standards Institute, which is a nonprofit organization that develops standards of practice for laboratories worldwide. So different states have different requirements for quality assurance and improvement in healthcare facilities. Each facility may have its own policies and procedures regarding quality assurance and improvement. In 2011, the U.S. Department of Health and Human Services established the National Strategy for Quality Improvement in Healthcare. The National Quality Strategy has three basic aims: better care, healthy people, and affordable care. So as we mentioned before in this presentation, certification is a process used in healthcare to ensure skills are mastered, or at least the level of proficiency has been completed for particular positions. It is not the same as licensure, which is a legal document stating that you have met certain standards. Clinical experience is always important in any healthcare facility, and that's the experience working directly with patients in a healthcare facility. And in most areas of healthcare, you should be required to maintain a level of continuing education. This education is intended to keep healthcare workers up to date on changes in medicine that affect their jobs. It also addresses new equipment, new procedures, or new policy changes, or provides a review of important topics. Now, there are several organizations that certify phlebotomy technicians. Some of the most widely recognized certifications are from the American Society for Clinical Pathology, the National Center for Competency Testing, and the National Healthcare Career Association, for which Queensborough is associated with. Before taking a certification test, most students must complete a recognized training course and must already have clinical experience working as a phlebotomy technician. Phlebotomy program should include clinical experience to give students hands-on practice with patients. Clinicals, as this training is sometimes called, may be arranged by the instructor and take place under the supervision of healthcare professionals. If this is not possible to do clinicals at a healthcare facility, the instructor may set up lab areas for volunteers to have phlebotomy procedures performed. Certification agencies require that students perform a set number of venipuncture and capillary punctures before receiving certification. The number varies widely from one agency to another. A student seeking certification as a phlebotomy technician should check the certifying agency's website at the beginning of training and several times during the training. The agency website will have the latest information about testing requirements and fees, as well as study and review materials available for purchase. In most cases, certification tests are computer-based and timed, and results are received immediately after testing is complete. The tests are given at special testing centers and must be scheduled in advance. A phlebotomy technician may either receive a high school diploma before certification is granted or must furnish proof of receiving a diploma within a certain time frame after receiving the certificate. Some testing agencies award temporary certificates to high school students until they submit copies of their high school diplomas, but facilities are unlikely to employ a phlebotomist who's not completed high school. Once a phlebotomy technician is certified, he or she will need to maintain that certification. Most certificates must be renewed every 5 years and require proof of ongoing work in the field, as well as a number of hours of continuing education. As said before, continuing education, also called in-service education, keeps healthcare workers up to date on changes in medicine that affect their jobs. It may also address new equipment, new procedures, and employer policy changes. The phlebotomy technician is responsible for meeting deadlines and fulfilling the requirements for recertification. And when looking considering certification agencies, look for organizations that require in-person instruction, require clinical experience, and are recognized by potential employers. And I'll just have to go on record to say that our program at Queensborough does meet all of that criteria. So the next segment of this chapter deals with the concept of professionalism and professional behavior. And the term professionalism does not simply mean receiving a paycheck for the activities that you do on a given job. There are very certain parameters, and we'll start with the terms and definitions. So professional means having to do with work or a job, but it could also refer to volunteer work and academic work as well. Personal means having to do with life outside of the job. The term professionalism involves behaving properly when on the job. And we're saying on the job is a catch-all for whether it's on the job, whether it's in the classroom, whether it's in the field as a volunteer. The term empathy involves identifying with the feelings of others, which is important when you're involved with certain patient care aspects. Being tactful involves showing sensitivity and having a sense of what is appropriate when dealing with others, especially when you're going to be dealing with all certain different types of personalities in the healthcare field when working as a phlebotomy technician or medical assistant. And being conscientious involves being careful, guided by a sense of what is important and what is right, maybe giving that extra attention to detail that a patient needs. And just remember that when the phlebotomist behaves in a professional manner at all times, the following things occur. It helps put the patient at ease, who may already be a little anxious about having blood drawn from them, communicates respect and earns respect in return, helps ensure continued employment, because no healthcare facility is going to want to maintain or retain an unprofessional employment, and again may lead to promotions and opportunities and or raises as well. So what are some of the acts of professionalism that the phlebotomist should be held to or expected of? Well, one, providing care appropriate to each patient, for example, adjusting communication as needed based on age or condition of the patient. Performing only assigned tasks and not discussing information beyond the phlebotomist's scope of practice, such as diagnoses or medical advice. Keeping patient information confidential. That's extremely important concept in all fields of medicine. What's discussed between you and the patient should only be discussed with people who have direct medical intervention with that patient. Always be polite and keep a positive attitude, even if you're having a personal bad day. Know your boundaries. Do not discuss personal subjects with patients, especially when it comes to politics and religion. That's just a real recipe for disaster there. I just said that. Do not discuss possibly controversial subjects with patients, not even your favorite sports team. Never use your personal phone in a patient care area. That is just one recipe for a disastrous public image. Never respond to a patient's profanity by using profanity in your own conversation. Know your limits, know your boundaries. Listen to the patient's concerns and take them seriously. If your patient may have piercings and tattoos and still tell you that they are deathly afraid of needles. Yes, it happens. Be empathetic with those concerns. Try to involve some problem solving skills to put the patient at ease. Call the patients by their proper names, usually by their pronouns Mr., Mrs., or just ask them how they would like to be preferred. It always instills more confidence in the patient if you explain the procedure step by step before beginning it, using proper terms rather than slang, and of course, always following proper infection control procedures. And just remember, in the field of phlebotomy, there are going to be certain expectations that your employer will have of you, as they would with any job, um, including completing tasks efficiently, always following policies and procedures, documenting and reporting carefully and correctly, reporting problems with patients or tasks and not just trying to sweep them under the rug. Report anything that prevents completion of duties, whether you may have some physical limitations such as an illness or conflict with the patient. Ask questions as needed. Always better to ask a dumb question than to make a stupid mistake. Take direction and feedback without becoming upset, as long as that feedback is given appropriately. Be clean, neatly dressed, and groomed. That all comes hand in hand with professionalism. Punctuality, being on time. Remember, if you're working in a healthcare facility and it's being run 24/7, if you come in late for your shift, that chances are means that the person before you doesn't get to go home on time. Communicate when unable to report for work. Let your supervisors be able to have enough time to make contingency plans. We already spoke about how important it is to always follow the chain of command. Participate in education programs. Develop your personal growth and knowledge. And be a positive role model for the facility, for the new people who are going to be coming in after you. So now, back when we were all children growing up, your teachers probably always told you the lesson, you can't judge a book by its cover, you can't judge a book by its cover, and to many degrees that is true. However, when it comes to medicine, or any profession for that matter, your personal appearance does take into account, it does send a message about how seriously you take your profession. So personal grooming and appearance and hygiene is important in every profession, especially in healthcare. Regular grooming makes people feel good about themselves and it makes a positive impression on others. A phlebotomy technician's grooming habits affect how confident patients feel about the care given. So we should probably all follow the very basic guidelines of personal grooming habits, such as bathing or showering daily and using deodorant. Overdoing it on perfumes, colognes, aftershave, and scented body creams should not be used, as patients may find this offensive or maybe even have allergic reactions to it. Uh, Brushing teeth frequently, using mouthwash, keeping hair clean, neat, brushed, keeping the facial hair short, clean, and neat, unless maybe religious observances dictate otherwise. Dressing neatly in clean, wrinkle-free uniforms, usually scrubs in most healthcare settings. Not wearing clothes that are too tight, baggy, stained, or revealing. Not wearing large amounts of gaudy jewelry, with the exception to the rule of maybe a watch for timekeeping purposes. Wearing an identification badge as required by the facility and is actually required by many state Department of Healths as well. Following facility policy regarding visible tattoos and piercings. Piercings may harbor bacteria, which may be a health hazard in certain types of healthcare facilities. Making sure that you're dressed properly for the day. Wearing comfortable, clean, high-quality, closed-toe shoes, sneakers. Keeping the fingernails short, smooth, and clean. Bacteria can be harbored underneath the fingernails, and it may make it more difficult for you to physically manipulate a needle when drawing blood as well. Keeping makeup to the minimum. Um, and again, these are just general guidelines, but all phlebotomists should follow their facility guidelines as far as personal appearance. Time management is an important skill to learn for every profession. Phlebotomy technicians must manage their time well. There are many tasks that must be done during their shifts, and each patient will require different tests and individual attention. Managing time properly helps the phlebotomy technician complete their tasks efficiently. Planning is the single best way to manage time better. Sometimes it's hard to find time to plan, but it's essential. Patients who need blood drawn are prioritized differently based on the tests ordered. Multiple tests are often needed, and there's a specific sequence required for filling the specimen tubes so that each test is as accurate as possible. Phlebotomy technicians should take time to check to make sure they have all the supplies needed for each patient, and supplies should be organized to make it easy to collect specimens in the correct order. Taking the time to organize and recheck can improve focus, decrease stress, prevent errors, and most importantly, if you feel like you're overwhelmed or you don't have the supplies needed to maximize your time efficiently, don't be afraid to ask for help. So if you've taken any type of healthcare or health related class in the past, you've probably seen these guidelines as far as managing stress. General guidelines to manage stress, including things like eating nutritious foods and staying away from the high salt, high sugar processed foods regularly, getting some form of regular exercise, either alone or with partners, checking your sleep habits. And in healthcare, that can be tough, especially if you're doing shift working. Drinking alcohol only in moderation and not as a means to self medicate. Stay away from tobacco, stay away from nicotine. There's just nothing good that ever comes out of that. And trying to balance your time so that you can regularly do something relaxing that you enjoy, whether it be meditating, a hobby, interactions with your peers, your friends, listening to music. You need to, no matter how much time may be dedicated to making a living, you still need to find time for yourself as well. Because not managing stress can cause a lot of problems, both physically and mentally. Some of these problems can affect the quality of a person's work and can also affect their personal and professional lives as well. Signs of not managing stress well include things such as showing anger or being abusive to patients, arguing or going head to head with supervisors, having poor relationships with coworkers, complaining frequently about one's jobs and responsibilities, feeling burnout, work-related burnout. Burnout is a state of mental or physical exhaustion caused by prolonged stress. It's chronic syndrome. Feeling tired even when rested and having a good night's sleep, and having a difficult time focusing on patients and procedures and the things that you need to get done in your life. So stress can seem overwhelming when a person tries to handle it alone. Often just talking about it can help improve the situation. Sometimes another person can offer helpful suggestions. Think about the resources that you may have on your job or in your field to help you with managing stress, like a supervisor, another member of the care team for work-related stress. Not taking your stress out on family members, but having your family members try to understand the stress that you're going through, making time for your friends, thinking about a support group, going on websites and finding a place where people share the similar job attributes that you do. For those of you who take comfort in worship, in religion, um, if it's really getting to you, think about making an appointment with a primary care physician uh, and possibly a mental health specialist as well. Primary care physician can help get the ball rolling as far as issues with anxiety and depression that go hand in hand with unmanaged stress. And then a mental health specialist can help continue that treatment. A local mental health agency. Uh, and any phone hotline that deals with related problems, like suicide hotline. Hopefully it never gets to that, but it's important to at least identify. It's definitely not appropriate to talk to patients about personal or job-related stress. Even if it seems like the patient is a friendly person and likes to engage in conversation, you may find it easy to fall into that. It's not a good habit to get into. So just remember, it's inappropriate to ever discuss personal or job-related stress with patients. It's never appropriate to badmouth the agency that you're working for either. So that in a nutshell is the first chapter for this course in phlebotomy. Please read over the textbook. Please go over your exercises. Please be prepared for the upcoming lecture, and we will see you soon. With that, have a great day.